Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Metformin is the cornerstone treatment for type 2 diabetes. It's effective, inexpensive, and recommended as first-line therapy worldwide. But here's the catch. Up to 1 in 4 patients develop gut issues, like nausea, diarrhea, bloating, or stomach pain. So why does this trusted drug upset the stomach? Let's go through the science. Inside the body, metformin lowers the cell's energy supply in several tissues, which switches on an energy sensor called AMPK. Think of AMPK as the common thread. Once it's activated, it helps lower blood sugar in different ways depending on the tissue. It tells the liver to stop making new glucose. AMPK makes muscle cells more sensitive to insulin, so they take up more glucose and burn more fat. AMPK also reduces fat storage and improves how fat cells respond to insulin. Together, these effects lower blood sugar and improve insulin sensitivity. And unlike some diabetes drugs, metformin doesn't force the pancreas to make more insulin, which is why the risk of hypoglycemia is low. But here's the twist. Metformin's actions in the gut are now recognized as central to both its benefits and its side effects. Metformin's oral bioavailability is only approximately 50 to 60%. Large amounts remain in the gut, where they accumulate in the intestinal lining at concentrations far higher than in plasma. This stimulates local glucose uptake and anaerobic metabolism, leading to increased lactate production, which may contribute to discomfort and diarrhea. And genetics can make this worse. Uptake into enterocytes depends on transporters like OCD1. People with reduced function OCD1 variants absorb metformin less efficiently, leaving even more of it in the gut lumen and raising the risk of intolerance. Metformin alters the composition of gut bacteria. For example, it promotes the growth of Akkermansia in the colon's mucus layer. This helps improve glucose control by strengthening the gut barrier, boosting GLP-1 secretion, and increasing production of beneficial short-chain fatty acids. But these microbial shifts also change fermentation patterns, leading to more gas and acidic byproducts. The result? Bloating, abdominal discomfort, and looser stools. Metformin also interferes with bile acid reabsorption and turnover. Normally, bile acids are released into the small intestine to help digest fats, then reabsorbed in the ileum and recycled back to the liver. Metformin disrupts this process. It reduces bile acid reabsorption in the ileum and also changes how bile acids are processed by the liver and gut bacteria. The result is that more bile acids spill into the colon, where they act like natural detergents, pulling in water and speeding up motility. This is a major reason some patients experience diarrhea with metformin. Metformin increases levels of glucagon-like peptide 1, or GLP-1. GLP-1 helps with glycemic control. But it also slows gastric emptying and changes motility, explaining nausea and fullness. Not everyone experiences gastrointestinal side effects, and there are a few reasons why. For one, genetics play a role. People with certain OCD1 variants handle metformin differently, which can influence how well they tolerate it. The gut microbiome also matters. Some people's baseline flora seem to make them more resilient against these side effects. Formulation is another factor. Extended-release metformin spreads the dose out more evenly, lowering peak concentrations in the gut and improving tolerability. And finally, how the drug is introduced makes a difference. Starting at a low dose and increasing gradually gives the gut time to adapt, which can reduce symptoms. For most patients, gastrointestinal symptoms are transient and improve after a few weeks. But for some, they're severe enough to cause discontinuation, leading to worse diabetes outcomes. So, what can clinicians do to help patients manage these side effects? One simple step is to tell patients to take metformin with meals, which makes it gentler on the stomach. Another common strategy is switching to the extended-release formulation. This releases the drug more slowly, lowering the concentration in the gut at any one time. Doctors also often recommend gradual dose titration, starting low and increasing step by step, so the gut has time to adjust. And looking ahead, there's growing interest in microbiome modulating approaches, which could open new ways to improve tolerability in the future. To sum up, metformin's GI side effects aren't random. They result from local drug accumulation, microbiome shifts, bile acid effects, GLP-1 changes, and genetics. By understanding these mechanisms, we can better support patients to stay on one of the most important therapies for type 2 diabetes. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.